It's time to remove the mystery from medicine, to seize control of one's health, and to genuinely comprehend the essence of terms like wellness and wholeness. The Ask Dr. Jill podcast provides information, knowledge, and empowerment information to empower you to be wholly well. Dr. Jill Waggoner has nearly 3 decades of medical practice and has a deep-rooted belief in diverse approaches to patient care, well beyond conventional medicine. This realization has fueled her lifelong pursuit of understanding a holistic perspective on health.
Well, welcome back to the Ask Dr. Jill podcast. Thank y'all for taking some of your day to join by YouTube, looking at us. Hey, those on YouTube are listening to us on your drive somewhere or just when you're relaxing in your backyard. I have a guest today. Yay. I have Kwame Garrett-Price, and I'm going to tell you a little bit about Kwame, and then we'll get started because I really want you to get some good information from him. Some of you might know Dr. Garrett-Price. I know Dr. Garrett-Price. His dad is a physician, and I just thought I'd throw that in. That is not shameless plug. Kwame is a Dallas-based entrepreneur and founder of Cal & K, which is a leather goods company and accessories company. In 2019, he was diagnosed with the rare condition von Hippel-Lindau. Am I saying that correctly? Yep. Von Hippel-Lindau, a life-altering event that sparked his journey into patient advocacy. This guided him to his current service on the board of directors of the VHL Alliance, a nonprofit and preeminent resource focused on supporting patients, families, and caregivers affected by von Hippel-Lindau disease. Kwame's personal experience has made him a passionate advocate for wellness, believing that health is our most significant investment. You know, that's my kind of going on. And so thank you so much. I think, first of all, it is rare to see an African-American man who is so into healthcare and wellness that you are an advocate. That you are a person who advocates for wellness. So welcome.
Thank you for having me.
I'm so pleased to have you join me. First of all, before we get into anything else, tell us about Cal & K, Leather Goods Company.
So Cal & K is actually my way of honoring my mom and my dad. It's Cal is my dad's middle name and K is my mom's middle name. So it was my way of thinking about them and putting that into the name there. Yeah. But I started Cal & K in 2015. I was working in San Francisco for a design and hospitality company. But it was pulling at me. I've always wanted to start a company like this, you know, and my dad had this really, really beautiful brown doctor's bag growing up. And you know how those look. The leather was just aging so well. Yeah. You know, and I've always loved pieces like that. So I knew I had to set out and create our own company making pieces that I would want to use. So I left for Paris and really just knocking on doors, trying to find out how to get a product made. You know, how to...
You left for Paris.
I left for Paris, yeah.
Okay.
And
Tell me more.
It was an adventure.
Yeah.
And I traversed all throughout Europe trying to find production, raw materials, and, you know, people just to get our things made. And yeah, it was an adventure. Paris was cool. I love it. I still love it, and I will always love it. You know, I felt at home there. I always feel at home there. And eventually we found some pretty good production that we were happy with. Yeah. You know, the know-how there I think is what I was going for as it, you know, comes to leather goods and how to make them beautiful, how I wanted to see it out into the world. And it just felt like a good place to go to execute my vision for Cal & K.
That is, so I was on your website, looking at some of the pieces, really nice pieces.
Thank you.
And I thought this is really interesting. I always try to make connections with people and with things. When you said you went to Paris, and I thought, I see why you're now an advocate, because that means if it involves you, if it's something that moves you, you've just told me in these few seconds how you make sure that you do the best you can to get the best that you can give. So that makes, I love that. That's great. I wonder how many people know that about you.
Not many. I'm very low key. Not many at all.
Yeah.
I just, as you said, I feel like if you're going to do something, do it and try to make it as well as you can, whatever that may be. Push it to the limit.
Yeah, you have, you all can probably pick up on it, but you have a very, what is the word? A very calming energy around you. And I'm not, but I feel people. I'm not anything weird, but you know how you walk in the room and you can feel somebody's energy and whether they're at peace. And so you have a very calm energy, and that's good. I can feel that.
I'm glad you picked up on that. I'm a peaceful spirit.
Yeah. So you are really focused on health and well-being. Tell us what brought you to the health and well-being place.
I never thought I would get there, coming from a family that is rooted in healthcare, from my dad and my mom being a nurse in the past, and my oldest brother, a personal trainer, and my second oldest brother is a physician as well. I didn't know where I was going to fit into that equation. And this random occurrence, happened in 2019. And I had this emergency craniotomy, brain surgery, at the top of 2019. And as the year goes on, it turns out I had this rare condition called von Hippel-Lindau, and was also later diagnosed with renal cell carcinoma, kidney cancer. Same year, within like 7 months of each other.
How old were you?
32.
Wow. Yeah.
Which is, at that age, you feel like, my career, it's going into a certain direction.
Right.
Maybe I'm thinking about love and relationship and marriage and starting families and, different things like that. But being strapped with that and having to deal with it was quite interesting. But, and it took some adjusting, but I saw that you got to conquer it, and you got to know that these things in your body, they don't own you. They, you own them. That's how I felt about it. And it was just a Jedi mind trick I did for myself. Like, that's all it was. Like, hey, you pay me rent.
Yeah.
And that's how I felt. And I think for me, that reversed the course of what could have been. And it allowed me to step into healing. Now I'm switching over into healing from being a patient or, not trying to be a victim of the circumstances or what was happening to me, which I downplay it, but it is quite, it's pretty significant and life altering, which is exactly what it did. But after a while, I began to think that if I can help other people that are in my position, because this is a rare disease, right? And I didn't know, it wasn't until recently that I began meeting people that have the condition, maybe like 2022. So I went.
You thought you were by yourself, so to speak. Not by yourself, because of course the support of your family, but by yourself in this disease journey. Yeah,
absolutely. And that's how it felt, So I wanted to find others like me and connect with them. So I reached out to the VHL Alliance, and soon after I got involved doing some advocacy work. And eventually I was asked to join the board, and I did. And it's been really cool. I love it. I love meeting other patients, hearing their stories and relating and sitting with them. It's because they're like me. They look around and they don't know anyone with this condition.
Or anyone who's even heard of it.
Mm-hmm.
Yeah, it's one of those things. And I think I had heard it, when you're in medical school, you hear of all of the rare conditions. And this one, I thought, what in the world? Even as a physician who's practiced for a little while, I had to look it up to see what it was.
Yeah, and it's likely you would never come across it, right?
No, never.
Yeah.
Not at all. And definitely not a patient that was under my care, and not someone that I even knew had it.
Mm-hmm. Mm-hmm. So the team we put together of specialists and primary care physician had not encountered it. And that was often what we heard. Oh, I may have came across it in med school, but didn't know I was going to see it again. So it's been a fulfilling journey for me. I just came back from DC a few weeks ago, and we gathered 30 patients from 18 states, and we sat down. They met a lot of people that are involved with VHL on the physician side, and we had psychosocial sessions. We talked, we laughed, we had fun, we did some touristy things together, and it was incredible.
Wow! And
this was my first time going to this young adult retreat, which is what it was for the organization. And when I got there, everyone, it felt like family, and I can see why people keep going back and doing that every year. It was cool.
Wow. So what did it look like? What did your health and wellness journey look like before the diagnosis? And what does it look like now after the diagnosis?
Before, I was always in shape, but it was that kind of exercise and working out to where you're kind of, how can I say it? You're beating yourself up a little bit, trying to get in the best shape you possibly can. You're hard on yourself, and you're worried about those things. So that was before.
The physicality of it. Yeah,
exactly. And I don't even think I was by doing that, you're not really treating your body right.
Right.
You're not recovering, you're not sleeping, you're not doing all the things you should be doing. So post-diagnosis, it changed, drastically. It was all about recovery, and my movement was more for my mind than anything else. Even to this day, that is why I move.
Wow. That is huge. I often say to patients, the journey is not about weight. It's about wellness, because we watch all of these parameters. We watch how many calories are in it. We watch how much do I weigh? We watch. It matters, but it doesn't really, because that's not the real issue. So often people won't work out because it's like, it doesn't work. How? You have to know what it is supposed to do. Yeah. It is not supposed to have you lose a million. That is not what you're doing. You're working for your brain to be well, for that, the neurochemistry in your brain to function well. You want your body to function well. That is big. That is absolutely big. The other thing that a lot of people don't know, when you're working out intensely like that, you're actually damaging your body. So you are causing cortisol to be so high that it's damaging blood vessels and damaging. So it's not that you're getting well, you are becoming a physical specimen that presents itself as what the world thinks well is, but you're not necessarily well. That's big. That is absolutely big. So what was it like? What was your food like before? What was your, did you do any meditation, relaxation? Tell me a little bit about that before.
Before, I did eventually incorporate yoga and a little meditation. I was living in Northern California, so the food options
were wonderful.
Well, exactly. They were amazing. So I was done really eating, bad stuff, if you will. So I think I was, doing well, but it wasn't intentional. It was around. I was attempting to, be the version of healthy that I knew, in our world. But afterwards, I think I got really intentional with my diet, and I don't even want to call it a diet, just eating regimen, realizing that food really is medicine, and it's healing, and it optimizes you, optimizes self, what you're putting in. And I didn't realize that I needed it in that way until afterwards, until after the diagnosis. But yeah, it did change how I eat, for sure.
So tell me about your diet now. Tell me about what a day in the life looks like for you in terms of what you consume, what you put in your body. Wow.
The mornings can vary, but they're usually one of three things. It's either a green shake, maybe vegan protein, half a banana, some spinach, water, and a little bit of lemon. Or today it was a bowl of yogurt with some crushed almonds, a little honey, cinnamon, and some blueberries. So I keep it light in the morning. And that's hard to do because that's my favorite meal.
Is it?
It is my favorite meal. If I could only eat one meal,
it would be in the morning.
Breakfast. Oh man, it's great. And I try to snack throughout the day, something easy, something light, usually walnuts, almonds, maybe if I haven't had a shake, maybe a shake. So lunch is usually something light, sweet potato, fish, and then by the evening, the same thing really. There's not much variation now because these things that I grew to know as like I need to feed my body, all of these things, I grew to love them. I enjoy eating and I enjoy my food, but half the time I don't even know if I care how it tastes all the time.
If you know it's good for your body.
Yeah.
It sounds like you have you have come to a place of understanding why we eat. And I think if people who follow me and look at my stuff, they think this woman has an obsession with food. But it's not. What I understand is it's like if you want to paint a room, go with me. If you want to paint a room, you got to have paint, you got to have brushes, you probably got to have a little ladder. If you have none of that, you cannot paint the room. You just can't. So food is what your body uses to repair itself. If you do not have good quality ingredients to repair yourself, it will not happen. And so you can plan to paint all, if you don't get the stuff, it doesn't matter. And that's what food is. And I think that we don't focus on that enough, even in medicine. The nutrition information that we got 30 years ago was abysmal. I mean, we had one 60-minute class of nutrition.
Wow. That's it.
Yeah. And not knowing about food as a physician is like being a firefighter and you don't know about water and fight. I mean, what am I going to do other than give you a medicine? But there are some things that we don't even have a medicine for, or we have so few medicines for it. Now what? So I think that is absolutely critical. So physically, you make the adjustments. What do you do for your mind when you are in the throes of, I'm about to hit this, I'm about to be in the world, you live in, on the coast where you want to be, and then you get hit with this diagnosis? What does that do to your mental health?
Ooh. It's like being thrown into a tornado.
Yeah.
Middle of the storm. It did a number on me. I didn't really know how to take it because I had to sit down, and that was the first time I sat down at 32. You're in this career that's a burgeoning career, going. now I see it as being fortunate to have the opportunity to sit down. You know, you don't get a break in adulthood, really.
No.
You don't. You don't get
bills
breaks.
And having to work. Those are two. Break ain't coming.
It's not coming. You're right.
No.
Yep. So at that time, I thought it was awful, but it didn't take me too long to accept the quiet and the peace that came with it. Even though, while you're realizing that it could be a peaceful situation, you could come out on the other end of this really well. It was difficult. It's very difficult. It's like being in a room with no windows. Almost is how it felt. So that's what it did to my mind. So my reaction was to get outside every day in the morning. I'm outside.
Wow.
5 minutes, 10 minutes, even if it's just 2 minutes, I try to get out and it changes. It softens everything else is what it does. You know, how you start your day. I found it to be so important after all of this. And for me, for my mind, I needed that. I needed to see the sky. It didn't matter if it was gray or if it was blue.
It's the sky. Yeah. What does the sky mean to you? Does it mean that things are limitless? Does it mean, what does looking at the sky mean for you?
Our lives have an infinite amount of potential.
Yeah.
And when I look up, that's how I feel.
Yeah.
I'll gaze and it's like, what is he looking at?
Yeah.
Nothing. As far as I can see, really.
Yeah.
And once you look up and you start seeing the behavior of the birds, bees, you see the planes fly by, you notice trees coming into your sight. I love it. I love it. And it's peaceful. It's calming. And that's probably why I'm rather laid back and calm now. I've always been that way, but it's so centering to do that. And
yeah, that's good. So you go from patient, young man, got this thing and so what was the transition that made you say, listen, let me now become an advocate for other people, not just, okay, I'm going to take care of me. I'm going to work on my body. I'm going to work on my mental health and my well-being. What was the switch that made you say that, let me help somebody else with this? What did that journey look like?
I began to think about what I saw my whole life, being under a roof where everyone's involved in healthcare and seeing how the impact it made in the community, one-on-one and as a whole. And I began to think about who I could help because it didn't feel really well being in that position. And it drove me to find my people, because in this life, a lot of people are your people, believe it or not.
Right.
You have many different identifiers.
Yes.
And so these patients are also my people. So I wanted to find them. I wanted to help them. I wanted to honestly talk to someone, That was the hardest part about this whole journey, that it felt it felt a little lonely, I have my family. I have great friends. I love all of my folks, but they only know so much about this experience.
Right.
So I needed to find folks that knew about this experience. I wanted to just speak with them and speak about what this is, what we're tasked with now, and also help, as much as I could, because it's frightening, and then when you think about the state of health and state of healthcare across America, what people have access to and what they don't, I was in a fortunate position, to have access to a certain level of care. And that's not always the case.
I know.
So folks need help navigating that and finding their people and who to see and what to do.
Yeah. One of the things that keeps me from, or at least makes me take pause about retiring from medicine as I do it, is there are not a lot of people who have a medical advocate. We don't know how to access healthcare. We don't know, we don't know what to ask. We don't know where to go. We don't know, have anybody who's fighting for us. And the system is so incredibly complex that it is. And when you have a major diagnosis, to try to get in the right place as you navigate through trying to be well. And then you got to try to deal with all of the rest of it. My grandmother would call it rigmarole. I don't know. That's all this rigmarole. What is rigmarole? I don't know. But meaning all of this stuff, it's almost like traps. Yeah. Having to deal with that. So what a noble thing it is to try to help people with that, to help people navigate through that. So a couple of questions. This has been really great. Thank you so much.
Thank you.
Couple of questions is, the first one is, what advice would you give to a young person who has encountered a major health thing, a health diagnosis, or, a major injury? And what would you say to them? And the other thing is, what do you say, advice do you give to the people around them to be able to help them navigate through? Because a lot of people don't know what to do when you become ill. They don't know what to do. So do we treat you the same way? People just don't know what to do. And so they often end up saying nothing, doing nothing, ignoring it. What would you? So on both sides of the equation, recommendations or advice?
Find a family practice physician.
Yeah.
I'm joking, but I'm for real.
It's the truth.
Very true. If you can, but I think your
daddy raised you well. No.
Good job. So you have to do everything that's within your power. Like anything else in life, there are factors you can't control, but what you can control, what you eat, your movements, how you move, your daily activities. And now I know all of our lives are different. I may wake up at a certain time and be looking at the sky, and someone else may be in traffic, or they may already be working. Like, we all have our routines, but do what you can for yourself. I find that always makes, at least in the moment, these conditions, and even long term, better.
Yeah.
When you're optimizing your body, you're giving yourself all you can in a positive manner, because it's easy to go within and everything turns negative. Yeah. Everything turns dark.
Your voices the voices in your head become negative. Yeah.
And as I spoke about earlier, that little Jedi mind trick about owning the condition, it really works. It really does. You're owning the condition. It's taking up space in your body, but it hasn't become you. It's not you. You're still there. So realize that you're still there, and you can do things to pull yourself up and pull yourself out of it as much as you can. Again, what you eat, how you move. You don't have to go run a half marathon or marathon. Maybe it's 5 minutes or 15 minutes of zone 2 exercise or something like that. Just light exercise, or on a mat, or Pilates or yoga. Find a routine that takes you out of that moment or that space you're in your mind, and just feels good. Yeah. I think that was the biggest thing that helped me. The small things, those little small changes over a long period of time, they become habits. Right. So now these things I just do naturally. and I've moved to a better state of health in my mind and my body. And for people around you, oh, bless them, bless their hearts, because it's difficult.
Yeah.
You know, and I don't think I realized that until I was being cared for. And I know it's difficult, and I know I'm not easy. You know, you're dealing with this thing and it's weighing heavy on you, and you're human. So it can, you know, weigh heavy on the person that's caring for you, your friends, your family. It's tough for them. So I would tell those folks, give them grace. You got to give this person grace for sure. They're dealing with something that's life altering. It's an out of body experience. You don't know what stage of their life they're in. They could feel like it's over because of this.
Right.
So in a way, you kind of got to have, you got to take it easy on them. You got to take it easy on them. But grace. But don't be, and maybe this is how I learn, but also don't be afraid to, if you see this person getting stuck, don't be afraid to push them a little bit and pull them out of that. You know, I'm not necessarily advocating for tough love, but you also, you know, when you're viewing someone else and you're seeing the human condition deteriorate, you have a responsibility, if you know this person, if you're close to this person, to grab them and pull them forward if you can, if you're comfortable with that.
Yeah, that's good. Well, Kwame, thank you so much.
It was a pleasure.
I really, really appreciate it. I hope that sharing your journey, first of all, let me thank you for being candid and just, you know, telling us about you and your wellness journey, being an entrepreneur and navigating all kinds of things. I think it is just so important that we have these real conversations with people. So thank y'all. Make sure that you like, share, you know, all the things. Y'all do this. Now, what I'm finding is people in my generation, we look at it, we don't know to like and share. Y'all, like, share, subscribe, like, share, subscribe. And until next time, thank you so much. I pray that you have wellness and love and joy and all of that. And we'll see you next time on the Ask Dr. Jill podcast.